Researchers at Mayo Clinic, Arizona have developed new treatments for the blood cancer multiple myeloma. The advancements are extending lifespans and offering hope to patients and their families. Joining us now is Dr. Rafael Fonseca, Chief Innovation Officer at Mayo Clinic, Arizona. Doctor, good to have you here. Thanks for joining us.
Thank you for having me. It's a pleasure.
Let's talk about multiple myeloma. What is multiple myeloma?
So myeloma is a cancer that arises from the bone marrow. Some people will call it a blood cancer. It affects mostly individuals in their 60s and 70s. It is a cancer that results from the abnormal growth of the cells that normally would protect us by producing antibodies. Everyone's familiar with antibodies now, as with COVID.
Yes.
But the cells can go rogue, and if they grow in an excessive way, that's what leads to the cancer form, which is myeloma. And patients, as a consequence, can have a number of symptoms like destruction of bones, anemia, and also problems with their kidneys.
How common?
You know, we have about 35,000 new diagnoses per year in the United States, so it's not an uncommon cancer. It's the second most common blood cancer after lymphomas.
Risk factors involved?
You know, most of it is just general susceptibility. Age is, of course, a factor. It's very slightly more common in men. It's twice as common in individuals that are African American, but by and large, there's nothing you do or you should stop doing that would make it less likely to occur.
Nothing environmental that you found so far?
No, nothing major. There's a few factors, but they're not major players in the risk.
The treatment, we can talk about your treatment, but heretofore, what was the treatment for multiple myeloma?
Well, when I started training, it was old-fashioned chemotherapy. That's 25 years ago plus, when we were using pills that were, considered in the chemotherapy category. And ever since, we've come a long way, where we now bring small molecules, targeted treatments, and most importantly, I think, immunotherapy approaches.
Immunotherapy is a big deal here.
That is correct.
How so?
Well, you know, people had a hard time at the beginning to know how to harness the person's immune system to fight back against cancer. Cancer, at the end of it all, it's a failure of our immune system to have recognized those cells as cancerous. So now, through genetic engineering and also through biotechnology, we can actually prime the person's own immune cells to go and fight back very specifically against this cancer cells.
Was there, and I know so many advances here from Mayo Clinic, Arizona, but was there an aha moment in terms of this development?
Yes, you know, I think the aha moment is a combination of things, and that comes out from the past 20 years, where we have seen over 20 FDA approvals for various treatments of myeloma, and we soon realized that one of them alone would not do the trick, so we had to create a team. And now through a team approach, meaning that we combine some of these drugs or treatments that we have available, we can put a large number of patients into very durable remissions.
And when you talk about durable remissions, are these situations where they are still compromised in some way, shape, or form? Because I know someone who has this and who has, it's like he's cured, for goodness sakes, for the past 20 years.
Yes, I mean, the best situation would be for someone not to be my patient, of course, that we meet socially, but the treatments are surprisingly well tolerated. And many of my patients, as I see them out in the street, I tell them, you know, people would not know that you're dealing with multiple myeloma. Now, we're very mindful, we're careful with the side effects. We explain all of this in detail to patients, but our goal is to get them back to their normal lives and as much as possible to a normal life expectancy.
Did research on other cancers guide this research on this particular cancer?
I think it's true, but it's true also in the reverse direction. That is, myeloma research has guided developments in other cancers, and we all talk to each other. We're somewhat silo approach that, yes, I focus on myeloma, but when we go to our meetings, I want to learn what they're doing in brain and lung cancer and all other cancers.
What about lymphomas, leukemia, these sorts of things? What is there a bit of a silo with multiple myeloma, or can it apply to
the silo walls are thinner there because actually they're next door neighbors.
Yes.
So lymphoma is a next door neighbor to myeloma. And well, they're fundamentally different, if you ask me, from the science and the biology. Some of the treatments that are used there we use as well too, and we exchange the use of some of those drugs and newer treatments like CAR-T.
So remission is possible. Is it likely, or is that just too individual a case?
It is very likely. So nowadays, if you take a patient who has a newly diagnosed myeloma, I should say that 95% plus of patients should achieve very good remission. What we call a complete remission, meaning a disappearance of those tumor markers that allow us to know that there's myeloma in the background, should occur in about 70 to 75% of patients.
Now, but are we talking cure here?
Well, you know, it's hard right now to talk about that. I am personally convinced we're already curing a fraction of our patients. For most of the ones we tell them are cures, when we look back and we see that they were diagnosed 15 or 20 years ago, and still there's no evidence of recurrent disease.
Yeah. We're going to talk about vaccines, mRNA vaccines tomorrow, but I want to find out if there is such a thing as a vaccine possible for this.
You know, there's some work going on, but it's not at the forefront for our progress right now. I think most of the most exciting areas is modifying the person's own T cells, something called CAR Ts,
Yes.
and bispecific antibodies. So we use those now routinely in the clinic and with wonderful results.
So, and I want to talk about what you're doing and why these results are so wonderful. What are you doing differently than other hospitals, research organizations, what they're up to?
Well, we've taken a multi-pronged approach that involves, multiple aspects. Of course, working with the multidisciplinary teams. We have research laboratories that are devoted to the study of myeloma, its origins. Importantly, how can we go about treating this? We think we can provide state-of-the-art clinical care, and that's aided in no small part because of the technology we have for diagnosis, for monitoring, and also a big chunk of this is our participation in clinical trials. So it's a composite of all of that I think makes this quite special for patients.
And so advancements from here, where do you go? What do you focus on?
Well, we started here working quite a bit on genetics, and that was the genesis of our program and understanding genetics as prognostic markers, also as therapeutic tools. And now we have evolved to make that be a pathway for drug development, some of which seems to be quite effective.
Okay, is that drug development in the market or is it still under clinical?
Some of that is in the market, some of that is commercially available, some of that is still under development that we hope will bring additional options for patients.
I got to tell you, this seems like it's somewhat, we've talked about immunotherapy on this program since really it was a brand new word and we were all very excited about it. Seems to have come a long way, but this seems like it is an especially good cancer story. Am I getting that wrong?
I think it may sound self-serving, but I think myeloma has been an example for many other cancers because the number of approvals, the developments in understanding the disease, and most importantly, the ability to change the survival for patients made it a very attractive field. I mentioned I started 25 years ago. No one wanted to do myeloma. You were last in line if you were doing myeloma. Nowadays, everyone wants to work in myeloma because of this dynamic environment.
Wow. Well, congratulations on all the great work there and the great stories. Dr. Rafael Fonseca, again, Mayo Clinic, Arizona. Again, we love doing positive health stories, and this is one of them. Good to have you here.
Thank you. It's my pleasure to be here.